Hi, I'm Lindsay, and I'm going to be your speech language pathologist today so that we can help you get some of your swallowing difficulties worked out. I know you've been having some trouble, is that right?
Yes, lots of residue in my throat, especially.
Oh, okay. Well, it's not uncommon, but we have different techniques that we can teach you to help you improve the ease of your swallow.
Thank
Um,
God.
so we'll just start with one of the techniques, which is called the effortful swallow, which is kind of exactly what it sounds like. But it's basically swallowing, but with a lot more intensity. So you're going to swallow as hard as you can. Basically, you want to feel the muscles in your throat tensing and feel the top of your tongue against the roof of your mouth.
Okay.
And it's kind of like the back of your tongue. So the goals of this technique are to help you um, increase how much your tongue can raise in the back to the roof of your mouth so that it'll help the whatever you're drinking or eating, it'll help it go down your throat easier. And then also by tightening your neck muscles, it'll help the pressure in your throat, which helps whatever it is you're eating or drinking go down into your system easier and not leave as much residue behind.
Okay,
So
great.
yeah, and it'll protect your airway. So it'll keep you from, I don't know if you've had this problem yet, but we want to avoid it completely. So it would help you reduce getting any fluid into your airway. So
Oh,
hopefully
okay.
that can help as well.
Great.
So first, I'll just show you what it looks like. It's pretty hard to see what it looks like because it's more about how you feel, and you have to feel your throat tightening or your tongue touching the roof of your mouth. So you might see my neck tighten a little bit, but it's more about how you notice the effort in your swallow. So I'll just go ahead and do it with saliva first, and maybe you
Okay.
can get an idea. So do you see how my throat kind of tightened up a little bit?
Yes.
Okay, so that's, I mean, that's how it looks, but I think the next thing that I'm going to do will help you with it because I'll describe each step. So this will help you to kind of know what it's going to feel like, and then we'll practice.
Okay.
So so you're going to do this exercise with each mouthful or sip after you eat or drink something. So first you're going to collect all the saliva or whatever food it is that's in your mouth or drink, and try to collect it all in the center of your tongue. And then you're going to try to keep your lips closed and tight together so that nothing can come out, and also to increase the pressure in your mouth. So after that, you're going to press your tongue against the roof of your mouth as hard as you can. So you're trying to increase that pressure. Um, and then you're also going to squeeze all the muscles of swallowing, which is in your throat and just like all around your mouth. Squeeze them as hard as you can too. So it's going to kind of feel like I don't know if it'll feel like you're swallowing a golf ball, but that's kind of the idea that we tell people to think about so that they can uh, really engage those muscles. So
Oh, wow. Okay.
basically, it's like you're swallowing a golf ball in one big hard swallow. So I'm going to have you practice some more, but whenever you need to take a break or rinse out your mouth, you can do that whenever you need to. So just let me know if you need a break.
Okay.
So you're going to start with your tongue at rest first, and then
Okay.
you're going to press your tongue against the roof of your mouth as hard as you can, and then swallow as hard as you can, which I've already told you. But I just want you to keep those things in mind while you're swallowing. So we'll first do it with saliva.
Okay.
Nice. Did you feel any difference in your normal swallow and doing that?
A little bit. I think I'll try it again and try to tense up my neck muscles a little bit more.
Okay, yeah, and that'll help. It's going to take a little bit of getting used to. You have to just think about what you're doing while you're swallowing. So if you want to try it again you can do saliva again, or you can use the water that you have. Either way, it's fine. How did that one feel?
That felt a lot better.
It looked like it was more effortful, more tense.
It felt like it.
Okay, good. So now that you kind of have an idea of what it's supposed to feel like, we can practice some more. And I'd like to have you practice so that you can increase, your awareness of what's going on, and like increase your ability to sense how effortfully you're swallowing. So that way each time you can swallow harder if you don't feel like it was hard enough or if it wasn't helping. So we're going to practice. We're going to aim for 10 times, but if you can't keep going, that's completely fine. So just let me know if you need to take a break or if you can't go any further. So this will just be to help you and see where we need to go from here. So whenever you're ready. How did those feel?
I think the first one, I didn't squeeze hard enough. But then the second one felt a lot stronger.
Okay, good. Yeah, it looked like the first one you didn't have as much of an easy time with, tensing your muscles up. So would it help if I did it again for you so you can watch, or would you like to just keep going?
I think I'm good to just keep going.
Okay, awesome. So just whenever you're ready.
Okay.
Nice. Good job. So how did that feel? Did you feel like it got better each time?
Yeah, I felt like after I did the 10, I feel like now I have a hang of it, and it just took a little getting used to it first.
Yeah, that's normally what the process is like for most patients. So, I mean, even for me at first, I was like, I don't know if I'm doing this right, because nobody else can really feel that except you. So, I guess you just have to, I mean, if it feels a lot different than a normal swallow, and if it feels like you're putting a lot of pressure on your tongue and tightening your throat, you're most likely doing it correctly. So, yeah, we'll just have you keep practicing these, and we can introduce some more going on in the future to help you with your swallowing. So yeah, we'll just stick with this one for now and have you practice at home and when you're here. So do you have any questions?
Not at this time, but thank you so much for all your help and your insight and feedback.
You're welcome. Yeah, we just want to get you back to swallowing and being able to drink and eat what you want as safely and easily as you can. So, all right. Well, I hope you have a good day.
Thank you. You too.
Thank you.